disease. And tonight we're going to talk about a strange disease called GERD. It's a gastroesophageal reflux disease. There are a number of people that have this problem. And it's very distressing because when you swallow your food, normally you feel no untoward effects. But in people who have GERD, they have severe indigestion. Now, indigestion is one thing, but severe indigestion secondary to GERD has some ominous implications. And bear with me for just a minute. I'm going to draw you a quick picture of the stomach. Now, when you swallow, food comes down the esophagus, and it goes through a little valve that is positioned right here. And that valve allows the food to go into the stomach, but it doesn't allow any of the gastric acid that's in the stomach that is responsible for breaking down the material that you've swallowed. In other words, food comes down, but it doesn't go up. In people who have gastroesophageal reflux disease, they have a valve that is non-functional. As soon as food hits the stomach agitates the food, and cells along the lining of the stomach are called parietal cells, and they secrete acid that helps break down food products. Well, what's above the little valve here? It's our esophagus. It's the same tissue as your skin. So if acid from the stomach goes up into the esophagus, it burns the esophagus, just like it would be if you poured acid on your skin. Well, that is the flaw in gastroesophageal reflux disease. There are surgical procedures that are helpful in controlling this, but many times the symptoms themselves can be ameliorated with the judicious use of cannabis. So if this area here is not functional and acid gets flushed up into your esophagus, you experience the burning. If we can control that, the patient feels a lot better. And last but not least, the cells that are lining the esophagus right here are skin cells. Over a long period of time, acid being flushed up into those skin cell areas and burned can cause a bad problem called cancer of the esophagus. It's the so-called Barrett's disease of the esophagus. So if we can discourage the ongoing flush of acid into that area and discourage the pain, we have helped the patient.
Thank you, Doctor.
Thank you.